Yeah, thank you. Thank you, Avdeshji. So I first welcome all the participants, all the district nodal officers, program officers from all the state. I welcome everyone on the national webinar series. So as we know, the today's webinar agenda is NP-NCD program overview, and we have Dr. Tushar Nale, DADG, DGHS MOHFW as a session expert. So we'll be listening from Dr. Tushar about the overview of the NP-NCD program. And after that, we'll be having a question and answers session. So I request everyone to post their questions in the chat box so that we can provide you the answers for the same. And after that, it's a vote of thanks. So the program, uh, so I think over to Tushar, sir. Uh, Thank you. Avjeshji, there is no audio.
Yeah, allow me a second.
Okay. So, good afternoon, everyone. I am Dr. Tushar. I am Deputy Assistant Director General at the Ministry of Health and Family Welfare, looking after National Program for Prevention and Control of Non-Communicable Diseases. So, we know that in last decade, majority of mortality was due to infectious diseases. But now, over the decades, as our country make a progress toward development, that epidemiological shift has happened, and now from infectious mortality is more due to non-communicable diseases. If you go to the stats, more than 60% deaths are due to non-communicable diseases. And in view of this, the Ministry of Health and Family Welfare launched this National Program for Prevention and Control of Non-Communicable Diseases. So today we will have a discussion and a brief overview about this NP-NCD program. So under National Program for Prevention and Control of Non-Communicable Diseases, we are looking after cardiovascular diseases, including hypertension and STEMI and stroke, diabetes, chronic kidney diseases, COPD and asthma, liver, non-alcoholic fatty liver, cancer, primarily oral, breast and cervical cancer, and STEMI and stroke we already discussed. And these activities are being supported through the 36 state NCD cells. So this program is being implemented in all over the country, all 36 states. 753 districts covered for the NCD. 770 district NCD clinics are being delivering NCD related services at the district hospital or the district level health facilities. 6,410 CHC NCD clinic are functional. As of now, 317 district daycare cancer center for the chemotherapy are being operational. 233 district cardiac care units are functional. For the cancer care, 20 tertiary care cancer centers and the 19 state cancer institutes are being operational for this under this program. So as a background, if you go to the burden of these non-communicable diseases, globally around 74% mortality due to NCDs, while in India, if I go for the figures of the year 2022, almost 66% are deaths due to the non-communicable diseases, out of which 28% are directly linked to the cardiovascular diseases, 10% are due to cancers, 12% are the chronic renal diseases, and so and so. so far. So, but then if you can see that we have almost 66% of mortality burden due to NCDs. And this is because of the rapid urbanization, sedentary lifestyle, change in the food habits more toward the ultra processed food and the junk food we eat from since childhood. And these are the main reasons for the increase in the non-communicable diseases. As we know that WHO through Sustainable Development Goals has a few of the indicator or target for each country for various disease or disease condition, and for non-communicable disease, SDG target is 3.4, and which mentions that by 2030, reduce by 1/3 premature mortality from non-communicable diseases through the prevention and treatment and the promote mental health and the well-being. So non-communicable disease has been specifically identified for the intervention with respect to the, so that premature deaths that can be reduced. So overview, what are the objective or what are the activities intervention are being undertaken under this NP-NCD program? So health promotion and awareness. So modifiable risk factor that needs to be modified so that NCD can be reduced, or the risk for the NCD that can be reduced, and for that health promotion and awareness is important. Initiatives such as Eat Right movement and the Fit India movement through the FSSAI, this is being done for the increasing the physical activity and the focusing on the awareness generation with the correct or the healthy diet that is being done through the CT program. Population-based screening for 30+ population, that is population above 30 years for the 5 common NCDs. So this is one of the important intervention for the early diagnosis and the treatment for this 5 common NCDs. Management of the hypertension, diabetes, oral breast, cervical cancer, COPD, CKD, ST elevation, myocardial infarction, stroke, and the NFLD, non-alcoholic fatty liver disease. So under the program, there are another component for the treatment, management, and the treatment of these diseases. We have a national NCD portal for data recording and reporting so that we can monitor the progress and link the patients to the appropriate services. Continuum of the care of the NCDs and the national multisectoral action plan for non-communicable diseases, which is whole government and whole society approach, where all the government department and the related society stakeholder that can join together and help the reducing the risk or the for the non-communicable diseases. So we know that NCDs and the major risk factors. So alcohol abuse, physical inactivity, air pollution, smoking, and the unhealthy diet. These are the major risk factor for all the major common non-communicable diseases, chronic kidney diseases, COPD and asthma, cardiovascular diseases, STEMI, stroke, hypertension, diabetes, cancer, and non-alcoholic fatty liver diseases. Physical inactivity and unhealthy diets are major precursors of the obesity. So we know that over the last decade, there is rise in the obesity, almost from 21% in the adult male to 26% increase in the obesity in the males, and females also. There is steep rise in the obesity in the childhood. There is a steep rise in the childhood obesity. There was a study published in March 2025, the Lancet, where the forecast was done forecasting was done on the disease modeling on the obesity, and by the year 2050, it is estimated that more than almost 45 crore people will be either overweight or the obese, and this is the one of the major precursor for the obesity, is one of the major risk factor for the non-communicable diseases. So these are very interlinked and may cause multiple types of the non-communicable diseases. So cardiovascular disease, hypertension can lead to the chronic kidney disease. So obesity leads to the hypertension, diabetes, and this can lead to the chronic kidney diseases. Eventually, cardiovascular disease like hypertension leads to STEMI, stroke, and other diseases also. So this obesity also leads to the non-alcoholic fatty liver diseases. So these are the major physical inactivity and unhealthy diet is a major risk factor with respect to the non-communicable disease. So under National Program for Non-Communicable Disease Prevention and Control of Non-Communicable Diseases, population-based screening is a major initiative where early diagnosis and the treatment has been planned, and this has been being done through the community-based risk assessment strategy at the grassroots level. ASHA and A&M through CBAP form identify the high risk individuals and then refer to the Ayushman Arogya Mandir, and for the further evaluation and in at the Ayushman Arogya Mandir, that patients or that subjects has been common general population has been evaluated and then referred to the if found appropriate, then referred to the higher center for the initiation of the treatment or the further evaluation. So for hypertension, digital blood pressure measurement is being taken. For diabetes, random blood sugar. For breast cancer, safe breast examination or the self breast examination is the methodology. For cervical cancer, VI is the methodology, and oral cancer is the visual oral examination is being done. And these are the methods are currently being employed for the population-based screening or for screening for the 30+ population for this common diseases. If you go through the achievement, so over the last almost 7 diseases, from there is a significant increase in the number of 30+ population that has been screened, and it has been for hypertension. Achievement is for as on 1st of June 2025, almost 37.8 crore individuals has been screened. For diabetes, 37.63 crore individual has been screened. For oral cancer, 31.70 crores. For breast cancer, 60.6 females has been screened, and for cervical cancer, almost 10 crores females has been screened. So this is an Indian and an achievement with respect to early diagnostic or early detection of these 5 common diseases. So all the individual which has been screened and found high risk or there is a risk, they were referred to the Ayushman Arogya Mandir or the PHCs or the CSCs for the appropriate evaluation and the treatment. So key achievement with respect to the NP-NCDC, we have 75 by 25 initiative, 75 million people with hypertension or diabetes on standard care by treatment by the December 2025, and we already achieved this particular goal. The National Multi-Sectoral Action Plan is for prevention and control of non-communicable disease in India, 2017 to 2010 already been done, and we are in process of the redevelop or plan development of the plan for the year 25 to 30. India Hypertension Control Initiative initiated in 2000, current being implemented in 157 districts from 27 states to strengthen the cardiovascular disease component of the NP-NCD. Stroke, we have developed guidelines and third revised guidelines released in the year 2023. ST elevated myocardial infarction guidelines released in 2023. NFLD, non-alcoholic fatty liver diseases guidelines are being released for on the September 2027. So these 5 diseases are already being covered under the population-based screening, and these newer initiatives like stroke, ST, elevated myocardial infarction, NFLD, COPD, and that will be being implemented in phase-wise in from this year onward. Few of the states and districts already rolled out this kind of initiative, and training of master trainings being done and cascade training are being done. Pradhan Mantri National Dialysis Program implemented in all 36 district IOTs and 748 districts, and PMND portal has been launched for that. Teleconsultation through e-Sanjeevani, capacity building of community health officer to use e-Sanjeevani platform is being done. This is a overall health system strengthening component of the NHM, strengthening of a tertiary cancer care facility scheme, National Cancer Registry Program through ICMR for 38 population-based cancer registry, National NCD portal, mobile and cloud-based analytics system to facilitate deliver management, planning, and monitoring of the NCD services through the public health system. So 75 million people with hypertension or diabetes on standard care by 2025, based on the accelerated focus on approach to achieve target under the National Health Policy 2017. 80% of non-hypertension or diabetes patients are under control by 2025. It's a roadmap to scale up hypertension or diabetes mellitus services in the primary health care. So key indicator are the how many patients were diagnosed, how many patients on treatment, follow-up, patient and control, and the prevention and control complications. Though diagnosis and patient put on treatment indicator is very good, but then follow-up and the patient under control, this indicator that needs a significant improvement with respect to hypertension and the diabetes also. The strategies under this intervention are the implementation through implemented WHO HERTz technical package, capacity building and training, strengthening on the population-based screening and the patient adherence by community health officer, ANM and the ASHA, strengthening of the supply chain of the management of the NCD drugs, supervision and monitoring, NCD portal utilization, data analysis and feedback, community health camp, linkages with the other health program and engaging partners as per national NCD multi-sectoral action plan. As a part of this drive, also early diagnosis and treatment. In the month of from the 20th February to 31st March, we had one massive campaign for the improving the screening component during that particular period, and more than 10 crores of population was screened during that particular component or particular period of the campaign. So achievement under 75 by 25 is burden of hypertension diabetes as per NP-5. We know the prevalence is around 24% hypertension, 12.3 crores estimated to be standard care, and prevalence of diabetes is 15.6%, 8 crores estimated to be standard care of treatment. So for hypertension, we already know that the 37.81 crores patients subjects were screened. For diabetes, around 36.63 crores subjects for persons with 30 plus age has been screened, and for hypertension almost 4.57 crore diagnosed patient has been put on treatment. For diabetes almost 2.37 patients has been put on the treatment. For stroke, we have advocating hub and spoke model for NCD. Hub will be the district hospital, medical college and the tertiary care hospital, and spoke will be the district hospital or the CH. Stroke or the STEMI, their initial 1 hour or initial golden hour is very important, and for that at the spokes they are expected to stabilize patient and maybe initial intervention undertake, and for then that will be referred to the further management at the hub level. And this is very important or crucial period where we can save the life of the patient if we start the early treatment for the stroke and the STEMI. So for the services available under stroke is the awareness about the sign and symptoms of stroke in the community, reach to the nearest spoke as soon as sign and symptoms shown in the patient, do a CT scan, and if ischemic stroke thrombolysis to be done, and refer to the nearest hub with the ambulance services. So there are already guidelines available for the management of the stroke. ST elevated myocardial infarction or the STEMI, we call that. Again, for this we have hub and spoke model for the NCD. Hub will be the district hospital, medical college, tertiary hospital, and spokes will be the district hospital and the CHCs. Services available to reach to the nearest spokes as soon as sign and symptoms shown in a patient. Do ECG or if STEMI, and if ECG is there, then abnormal ECG is there, and based on the guidance by the hub, thrombolyze that particular patient, and then refer to the nearest hub with the ambulance services, so that patient get the early initiation of the treatment and the further treatment that can be referred or that will be referred to the higher center for the treatment, so that the golden hour period where if they initiate the treatment, there is maximum possibility of the survival that can be achieved or that can be get through this hub and spoke models. Non-alcoholic fatty liver disease. We know this is one of the newer emerging area, and India is the first country who has incorporated NFLD as a national policy. NFLD, there are many. If we diagnose early, we can reduce that particular NFLD. Treat or manage that particular NFLD. Otherwise, that particular patient may lead to the cirrhosis or maybe a further hepatocellular carcinoma. So for NFLD, this is a inverse pyramid structure where the 30 plus population is being screened. Population-based screening for risk factor for NCD, referral for high-risk individual, identification of the individuals with suspected at the primary health center, identification of the individual with suspected NFLD, referral for diagnosis of NFLD and evaluation of the clinical significant liver fibrosis, management of uncomplicated NFLD. At community health center, diagnosis of the NFLD, risk stratification of the referral to the specialist for the advanced liver fibrosis using non-invasive liver scores, example fibrosis 4, and district level hospital and above, management of the advanced days of the NFLD. Under NFLD majority for stage 1 or 2 majority time, the intervention is the diet modification, increase the physical activities and reduce the weight, and that will be done through the awareness generation and the counseling at the CHC or the PHC level. COT, chronic obstructive pulmonary disease operational guidelines has already been developed, and that has been available on the guidelines, and this is further being revised, and maybe by the end of in this financial year we will release the revised version. So under COPD at the sub health center level, health promotion and awareness generation for lifestyle modification, follow up patient for continuum of the care. At the PHC level, diagnosis and the treatment services, prevention and the health promotive services. At the CHC level, lab investigation, diagnosis and management of the services, referral for complicated cases to secondary level facilities. At district level, lab investigation, diagnosis and management services, referral of the complicated cases for the tertiary level. At the medical college, referral services for management of the complicated cases and training of the healthcare personnel for the operational research. So this is COPD also rising because of the rising air pollution, and COPD and asthma is also cases are the rising. So Pradhan Mantri National Dialysis Program, this is one of the Prime Minister's initiative to having the dialysis services at the district, at all the district level. So 2016-7 PMDT guidelines launched, establishment of the standalone hemodialysis units at the DH level. 2019 peritoneal dialysis guidelines was launched. In 2020-21 guidelines for dialysis of the COVID-19 patient, dedicated dialysis center set up in states duties for the conducting dialysis of the COVID patient. Financial support provided to 21 states for establishing peritoneal dialysis services under NHM, and in 2020-24 it is being implemented in all states, 743 districts, and PMDT portal also launched. So also for the help of the CHO or the ANM or ASHA, teleconsultation through eSanjeevani for the NCDC being implemented. By this particular portal, capacity building of the community health officer to use eSanjeevani platforms, follow-up of the patient on treatment of the NCD through it, and regular slots for specialty on NCDs and the district hospital and the medical college needs to be available, and that is being implemented through the eSanjeevani portal of the NHM. Cancer is being coming a big way. Strengthening of the tertiary cancer component through there is a tertiary cancer care scheme is already being implemented. There were state cancer institute and tertiary cancer institute that are being strengthened. 39 institutions, 19 SCIs and 20 PCCs funded so far. GOR state share is 60-40 and Northeast region is 19 to 10%. So activities through this tertiary care, diagnosis and the treatment component include medical, surgical, oncology or radio oncology is available, strengthened at the state cancer institute and tertiary cancer care level. Training of the doctors and health personnel, outreach and the screening activities, research activities, participate in the cancer registry program and the palliative care. National Cancer Registry Program that is being implemented through the ICMR in existence of the it is in existence since 1992, now under National NCDIR ICMR since 2011. National Cancer Registry Program functions through 38 population-based screen register and 215 hospital-based cancer registry across the different states in India, deals with the various cancer sites in the body. Challenge is the distribution of population-based cancer registry. So 38 is very limited number, considering the vast majority of geographical spread of our country, and that expansion of this particular thing, this is registry program is being considered as this. National NCD portal is one of the state-of-the-art NCD portal, the digital portal that has been developed. It has longitudinal health record with ABA IDs, offline data capture 11 in 11 local languages facilities available, screening and e-referral facilities available, or the functionalities available. Content delivery or the training, data intelligence, analytics, and work plan follow-up has been available. So at the population level, ASHA and ANM undertake the population enumeration and the risk assessment of the 30 plus population through the CBAP form. If they found that there is a score is more than 4, then that particular patient is being referred to the ANM and CHO for the NCD screening and the follow-up. If ANM and CHO file that, then that particular patient again referred to the medical officer and or the nurse at the PHC level for the diagnosis, either in the laboratory investigation or the any other investigation like the BP measurement or the any other measurement, and then that particular patient is again referred to the specialist nurse of the CS in addition. So all these parameter data has been digitalized so that each and every aspect of that particular patient is digitally recorded, and that record is available at the program official at the district and the state levels, and through this they can monitor the program performances. Universal health coverage services under Ayushman Arogya Mandir. So now under Ayushman Arogya Mandir, there are 12 expanded package of the services, where that 7 expanded services include the about the screening and the prevention and control of the NCD, which include health promotion and wellness, which is in the last minutes, ensuring continuity of the care, and the team-based approach, where the team of the ASHA, ANM, CHO, and the medical officer integratingly deliver the services of the NCD from screening to the treatment services or the in the follow-up services also. Like once the patient is diagnosed from the PHC or CHC, he can come regularly to collect the medicine at the at the Ayushman Arogya Mandir level, where they is regularly again blood pressure or the blood sugar level measurement can be taken, and accordingly, if required, modification of the treatment or the further referral and evaluation is being taken care at the Ayushman Arogya Mandir. So what are the services at the Health Center Ayushman Arogya Mandir? Health education, screening, referral of the suspected cases, dispensing of the prescribed medicine, teleconsultation, and maintaining electronic health record, and generation of the ABA IDs. At the services at the PHC and Ayushman Arogya Mandir, health promotion activities, screening of diabetes, hypertension, 3 common cancer, confirmation of the diagnosis, treatment initiate, and the management of the common NCDs, referral of the complicated NCD cases to the higher facilities, bidirectional referral linkages to be established and follow-up to be ensured. Again, teleconsultation and the maintaining electronic health records and the generation of the ABA ID. These are the services available at the Ayushman Arogya. Health promotion and the strategies is one of the key factor for the prevention of the NCD, because even if you have the early diagnosis and the treatment services, how many services or the management services we can provide? So for that, we need to we are focusing on health promotion and activities for the reduction of the modifiable risk factor with respect to the non-communicable diseases like tobacco, alcohol, healthy eating, and the fitness or the fitness with respect to the eat healthy and the eat right campaign. Empower under tobacco, empower measure like monitor tobacco use and the prevention policies, protect people from tobacco use, offer help to quit tobacco use, warn about the dangers of the tobacco, enforce ban on the tobacco advertising, promotion, and the sponsorship, and the raise taxes on the tobacco. Alcohol, that is awareness being regularly being done. De-addiction centers has been established through NHM, and through NCD clinics linkages has been established for that particular services, and through FSSI, Eat Right and Eat Healthy, Eat Right and Fit India movements, awareness generation component is also being taken care. Health promotive strategy, avoiding risk factor, yoga and wellness activity, Fit India movement has been done. 21st June is the International Yoga Day, and I am sure that all the state and youth is being conducting the yoga related sessions to generate awareness with respect to the yoga, and that's which help in the reducing the modifiable risk factor with respect to the non-communicable diseases. This is one of the another factor we are under revision for this national multisectoral action plan for non-communicable disease, which has the goal to reduce, prevent, and mobilize avoidable disability and premature mortality due to NCDs in India. NMAP identifies action for 39 departments and ministries. Action are prioritized for 15 key development department or the ministries. Strategic areas are key outcomes are the integrated and multisectoral coordination, health promotion, health system strengthening, surveillance and monitoring and evaluation of the research. So these are the 15 key departments that has been identified, and they are few of the action plan have been identified. We are in discussion with them, and soon we will finalize and they release this action plan for the 25 to 2030. This has been discussed through the FSAI coordination. It tried India movement. It adopts whole of society approach to bring all stakeholders together on a common platform on the foodborne illness and various diet related diseases cut across all age groups and all sections of the society. The movement is aligned with the national health policy. In this year, our honorable Prime Minister has given the clarion call for the reduction of the obesity and the 10% reduction or oil reduction, which help in the keeping the fit India or reduction the obesity. And this FSI is also partnering or focusing on this particular clarion call of the Prime Minister, and as a movement focuses on the preventive and proactive healthcare by working with the all food sector stakeholders from consumer to the manufacturer. The risk factor posed by the poor nutrition or unhealthy eating habits can be targeted for, and which in turn help in the reduction of the NCD. Way forward, community aware generation, including community participation, integrated approaching by leveraging technology to bridge the gap at all healthcare delivery system, quality screening by using AI-based point of care technology for early detection, strengthening of the CHC and district hospital for early referral and the confirmation of the nearest health care facility, capacity building, training and retraining of the healthcare worker, maintaining electronic health records and generation of ABHA ID through the NCD portal, and the revised document of NMAP map for the 2025 to 30 has been being prepared by the ministry with the technical support for the WHO. So this is a brief overview about the national program for prevention and control of the non-communicable diseases. Thank you.
Good afternoon, sir. Over to you, Dr. Avinash, sir. Pankaj, over to you. Could you please introduce Dr. Avinash, sir? Thank you.
Yeah. Thank you, Dr. Tushar, for sharing a brief overview of the NP-NCD program. And based on the demands from the states and districts, NP-NCD is now organizing a weekly webinar series starting from today. So from financial year 2025 to 26 on every Friday from 3:15 to 3:45 p.m. So thank you, Tushar, sir, for sharing a brief overview of NP-NCD program. Now we have Dr. Avinash, with us, DADG, DGHS, MHFW. So over to Dr. Avinash.
Thank you, Mr. Avdesh, and thank you, Dr. Pankaj. Just to update the participants that the webinar series, earlier webinar series, which we were having every fortnight, it was a monthly. We were having it twice. So we got a lot of requests from the districts as well as the states that due to frequent change in the officers, also maybe at the district level also officers are changed, lot of CHOs are joining, medical officers also, there are newer ones, and there is shifting within the programs also, and at the state level also there is a change in the officers, and also in a way capacity building should be a regular exercise. So we have kept we have increased the frequency to every week, and we have kept Friday because normally there could be that Saturday is a half day at places and it may not be working also at some places. So we kept Friday that to post lunch. So it will not interfere too much with the, probably we thought that it may not also interfere too much with the working timings. So 3:15 to 3:45 every Friday we will be having this, and the topics we have put it up in such a way that they will be of the practical use to the participants, and the speakers will be from the states. So in a way, it is also an opportunity to give leadership to the states, and it will also help the states, state nodal. So we are taking participants from the state nodal officers, the district nodal officers, as well as the medical officers at the PHCs or CHCs. If any if any state nodal officer, if he asks, and like we will ask the state nodal officers for certain topics for representation from the CHCs, PHCs, as well as the district hospitals. So in this way, it will be a nice platform for cross learning. And of course, the time will only be 30 minutes. We will never extend it. And the time for speaking and everything, it will be within 20-25 minutes only, so that it is, because that much is the amount of attention span we can hear other, and so as to keep, so it seems it is relevant. And of course, all of this, we are also in a way putting it up on the portal also, and this NHFW Saksham portal, we are exploring ways if it is possible to put it up there, this also can be seen by the state nodal officers and district nodal officers. So with this, thank you from my side. um, I think, Avdeshji, Pankajji, we can now close the webinar.
Sure, sir. With your permission, we can close the
Yes, sir.
webinar.
With vote of
That
thanks, with vote of thanks, we can close, sir. Thank you, Dr. Avinash. So it's a time for vote of thanks. So we want to thanks Dr. Swasti Charan sir, DDG NCD DGHS MHFW, Dr. Tushar DADG NCD MHFW, Dr. Avinash DADG DGHS MHOW, and all the participants, state nodal officers, state program officers, medical officers, and other health staff who attended this webinar. And last, Avdesh ji from the ECO. So thanks everyone for joining this webinar. And thank you, Dr. Avinash, sir. Thank you.
we've got a couple of comments in the comment box. We will keep a note of that. Thank you. We are reading the comment box. We'll keep a note of that. Thank you. Thank you. We can close now.
Thank you, sir. Well noted.